November is Lung Cancer Awareness Month. It is by far the leading cause of cancer deaths for men and women. Lung cancer is a common disease, but we don't talk about it nearly enough. Dr. Katherine Gray joins us this morning to raise awareness for early detection and talk about the different treatment options available on lung cancer. Dr. Gray is a specialist in thoracic surgery at Houston Methodist Department of Surgery. Good morning, Dr. Gray. How are you doing this morning?
Good morning, Len. It's so nice to be here. As you said, lung cancer is such an important topic, and it's important to get some awareness out there about it. So I'm excited to be here and hopefully can answer some questions today.
Yes, looking forward to it. Chai Time has been on air for 5 years, and we have never done a topic on lung cancer.
Wow.
So this is our first.
Wow. Well, I'm happy to be here to be the first for this.
Yes. So let's begin with the basic, with what is lung cancer?
So lung cancer is an abnormal growth of cells that begins in the lung. Now, this can be confusing sometimes because sometimes people will hear that lung cancer has spread outside the lung to other parts of the body or other places in the chest. What makes it lung cancer is where it starts. So if you have a cancer or an abnormal growth or mass or tumor that starts in the lungs, no matter where it goes, it's still considered a lung cancer.
Okay. And how big of a problem is lung cancer here in our state of Texas?
Yeah, so unfortunately, like the rest of the country and the world, lung cancer is a big problem here in Texas. So something like 13,000 people every year are diagnosed with lung cancer here in Texas. And as many of our listeners probably know, the biggest risk factor, although not the only risk factor for lung cancer, is cigarette smoking. And as many as 15% of Texans smoke.
Oh, wow. Yeah, that's a big problem.
It's a big problem.
And so compared to breast cancer in women and prostate cancer in men, how common is lung cancer?
So lung cancer is very common. So if you look just at the numbers of people that are diagnosed with each of these cancers, breast cancer tops the number of cancers for women, and prostate cancer tops the number of cancers for men. Lung cancer comes in just beyond that, so it's the third most common type of cancer. However, as you alluded to before, if you look at the people that are dying from cancer, lung cancer is the number one cause of death of people that have cancer.
Okay. So I guess now the next question would be, we've had so many guests that come here and we've talked a lot about breast cancer, and actually October was Breast Cancer Awareness Month, and we encouraged people, women especially, to go and get their screening done, their mammograms done. So is that the same for lung cancer?
So I'm glad you brought that up. So I think this is something that people don't really know about. So I think when people think about cancer testing and screening, people think about breast cancer, which is great. That's so important that you're getting your mammograms. And also for colon cancer, there's really good screening with colonoscopies. So I'm so happy that people know about those, and it's so important to get those done. There's also screening that's available for lung cancer. So if you are over the age of 50 and have a heavy smoking history, then you should be evaluated for possible lung cancer screening. Now, what does heavy smoking mean? So if you have smoked greater than 100 cigarettes in your life, then your risk of lung cancer is greater than someone who has never smoked. That doesn't make you a heavy smoker, though. So the way that we in the medical community count heavy smoking is 20 pack years. So that means that you smoked either 1 pack of cigarettes per year for 20 years, or 2 packs of cigarettes every 2 packs of cigarettes every day for 10 years. Now, I don't want the listeners out there to be trying to calculate those numbers. So basically, if you have smoked on a regular basis and you are over the age of 50, then you should be evaluated for lung cancer screening.
Oh, okay. And so what is the procedure like, the screening like? Because like
Yeah.
when mammogram, we know like you have to go through that machine. And
Yeah.
so is it like, is it similar, the machine, or you have to go through the entire, like doing MRI? Is it
Yeah.
similar to
So it's a
that?
little bit similar. So I would say of the three main cancer screenings, again, mammograms, colonoscopies, and lung cancer screening is probably the easiest, actually. So it's a CAT scan once a year.
Okay.
So a CAT scan, if for people that are claustrophobic or they get nervous when they're in an MRI machine, CAT scans are not nearly as bad. It's a much more open machine. It's very quick. The whole thing takes about 1 minute once the test begins, and you do it once a year. Now, the other thing that people wonder about with these CAT scans is the risk of radiation, because people worry that, oh, am I getting so much radiation with these CAT scans every year? Is that a risk to me? And the answer is no. So for lung cancer screening, the CAT scans are specially calibrated so that you're getting a really low dose of radiation that is not a risk, even though it's happening every year.
Okay, well, that's good to know.
Yes.
Because, like, that's true. What you
Yeah.
just mentioned about radiation, there's so much concern with that. So it's good to know, like, it's not, it's not harmful.
It's not harmful.
Correct. And so, Dr. Gray, what are the causes and risk factors?
For lung cancer. So, like we said, the one that everyone always thinks about is cigarette smoking.
Right.
That also includes other kinds of smoking, such as cigars. So those are also a risk and are included in the same way. The things that people don't think about, though, are, first of all, secondhand smoke.
Yeah.
So what I often see in my patients that come to see me with a diagnosis of lung cancer is they say, doctor, I've never smoked in my life. But once you start asking more questions, someone in their family, someone in their direct household smoked for years and years. And so unfortunately, that also puts people at risk of being exposed to those harmful toxins from cigarette smoke. And so that's the second most common cause of lung cancer is secondhand smoke, so being exposed to other people smoking. The other thing that people don't think about is radon, actually. So I think there was more awareness maybe in the last 20 years of something called radon. It's a gas that can occur in your house. You can't smell it, you can't taste it. It's not like natural gas where there's a risk of fire, but it can be present in really low levels, and there's special machines that can test for it. A lot of actually smoke detectors come with radon detectors as well that can identify whether that's a risk in your home.
Okay.
And that's also been linked to a higher risk of having lung cancer.
Oh, wow. That's interesting.
Yeah, never heard of that before, right?
Yeah.
Yes.
Yeah, usually it's like smoking or secondhand smoke. Wow. That's good to know, though.
Yeah, so everybody should go test their house.
So you mentioned about cigar smoking, cigarette smoking. How about vaping and e-cigarettes? What are your thoughts on that?
Yeah, so the baseline answer on that is we don't really know. So there's 50, 60 years of research on cigarettes and cigars that have identified different harmful toxins that are in that smoke and in those things that can cause cancer. Vaping just hasn't been around long enough for us to have fully studied it and fully understand. What I will say, though, is that unlike cigarettes and cigars, vaping can be almost anything. So I don't know if any of you all have kids that are vaping these days, but there's bubblegum flavored vape, there's, fruit smoothie flavored vapes. And what's in that oil, we don't really know because it's not regulated. So there have been a couple of chemicals that have been identified in some vaping substances that are linked to cancer, and that is many companies have tried to phase those out. But as we do more research and understand more about what's in each of these chemicals, we'll know more.
Okay.
What I will add, though, is that although we don't know the full extent of cancer risk from vaping or e-cigarettes, is that there are other risks to the lungs with it. So vaping, what we do know is that oil is still that goes into the vaping cigarettes. There's an oil that's heated up and then inhaled into the lungs. And what that does is you're basically literally inhaling hot oil into your lungs. And so it's been found that there can be infections and some destruction of the lungs from the inside with that.
Oh, wow.
The other thing that can happen is it can lead to a collapsed lung. So also due to damage from within the chest. So, the full extent and the full depth of the impact of vaping is still being researched, but we do know that there are some harmful properties of it.
Okay. I know because, there's a couple of friends who are chain smokers, and now they've switched to vaping. So because I guess in their minds, it's not as bad as just, smoking cigarettes, and especially being a chain smoker.
Yeah, and I do think that's true. So I think the best way to think of vaping or e-cigarettes is as a bridge to stopping smoking. So we know that cigarette smoking is highly associated with lung cancer. We know that there's some ill effects of vaping, but if you are able to go from chain smoking every day throughout the day to saying, hey, I'm going to substitute this for vaping, and then slowly work your way down off of that, that is something that I think can be a very successful strategy.
Okay. And so what are the common myths when it comes to lung cancer?
Yeah. So I'd say the most common one is, we're having all this conversation about cigarette smoking, is that you can get lung cancer if you have never smoked. So there's certain kinds of lung cancer that are more common or commonly occur in patients that have never smoked before. And some of those seem to have a genetic link, although we don't fully understand that yet. But I would say the biggest myth is that people who have not ever smoked cigarettes can get lung cancer.
Okay, so they'll probably show some signs or some symptoms, like, what are those then for secondhand smokers or?
Yeah, so unfortunately, most patients don't have, or most people don't have any signs or symptoms of lung cancer before it has spread or grown rather big, which is one of the things that makes it such a dangerous cancer. And that's also why it's so important that if you have those risk factors, that you get the screening, because the whole point of screening is to catch it before you have any symptoms so that something can be done about it early on. Now, people that do develop symptoms of lung cancer, it can be multiple. So often people will initially develop some shortness of breath or a dry cough that just won't go away.
Okay.
The other things that people might notice is, so say you've been smoking for years and years, you always have this sort of tickling, bothersome cough, but all of a sudden one day you start to see some blood in your cough. That can be a symptom of lung cancer, and that should prompt you a call to your doctor. And then other things like pain where the tumor is, if it gets to the point that it's invading into the ribs or the chest, weight loss, or just an overall sense of fatigue combined with any of these symptoms can be a sign of lung cancer.
Okay. So, doctor, we usually, when we go and see our family doctors, most of the time, I guess, it's a regular checkup or anything. But as we get older, should we be asking any additional questions when it comes to our health, related to lung cancer, or is it only, if I'm exposed to secondhand smoke or things like that? Or should we have any common questions that we should be kind of like asking?
So I would say that if you are not someone who has smoked or been around a lot of smoke, a lot of people that are smoking, there's nothing specific that needs to be asked. But I think it's always a good idea, especially if you have a healthcare provider that you trust and can have an open conversation with. It's always a good idea to bring up something that might be of concern, a new symptom, and just say, hey, is this something that I should be worried about? Is this normal? Is this not normal? And they can help direct you.
Oh, okay. That's good to know. And so how curable is lung cancer?
So that depends entirely on when it's diagnosed.
Okay.
So for cancer, and you, the listeners may have heard people talk about the stage of cancer.
Yes.
So for pretty much all tumors that we know about, doctors classify them by stage. What that means is how much it has spread, if at all.
Okay.
Okay, so the earliest stage is stage 1, and that means, so say for lung cancer, that means you have a small growth of cells in your lung, but it has not spread anywhere else.
Okay.
Okay, Then there's some middle stages, so that's stage 2 and stage 3 that are more advanced, meaning maybe it's a bigger tumor, maybe that those cancer cells have gone to some of the lymph nodes, which trap cancer in your chest. And then stage 4 is when it's advanced to the point that it's spread to other parts of your bodies, your brain, your bones, your liver, etc. So when we talk about cure, really the people that have the best chance of cure are patients that are stage 1, so the really small localized tumors. Those are the ones that we usually pick up at screening. So again, I'll make another plug for how important screening is. Because if we can find that cancer before it's gone anywhere else, then we can cure that cancer with surgery. Okay. So there's no, if you have a diagnosis of lung cancer, we will always follow you for the rest of your life to make sure it doesn't come back or there's not another cancer. But the best chance at cure for lung cancer specifically is surgery for those really early stage tumors.
Okay. And then after that, after the surgery, do they still have to go through chemo or anything as treatment?
So it depends. So if we catch it early enough, then no. So if we find, so what I often see as a surgeon is patients that will have a CAT scan done either through screening or for some other reason. We find a really small, size of a dime, size of a quarter lung cancer. We take it out, and if it hasn't gone anywhere, you don't need anything else. You'll get CAT scans at regular intervals to make sure it hasn't come back, but you don't need any additional treatment.
Wow. You simplify it so well.
Good, I'm glad.
Yeah.
Because lung cancer is such a, I guess the word cancer itself is very, it's scary.
It's scary.
And then when it comes to lung cancer, it's just like there is, so many times it's more like, oh, if you have that, it's, it's not like breast cancer. There's a lot talked about with breast cancer. There's a lot of, awareness. But when it comes to lung cancer, it's so different. And in our minds, it's just like, if we have lung cancer, that's it. There's no cure. There's but now there's so much of advancement. And that's what I wanted to kind of talk about too, the different treatment options that are available. Because when we had decided to do this topic, I did a research, I was reading on things, and I was like, wow, not realizing that things have changed. There's so much more advancement now, even like you stress about screening, which never really occurred to us. And I'm sure to a lot of our listeners too, that, there is screening available, and you're not exposed to a lot of radiation. So it's such an eye opener for us.
Yeah.
Absolutely. So let's talk about some treatments, some treatment options which are available for for lung cancer.
Yeah, absolutely. So this is a really exciting area right now because, I think there is a very common sense that if I have lung cancer, then like you said, then that's it. There's nothing can be done. And that's absolutely not true. So there's been so many advancements in medicine in the last 10 or 15 years that particularly in the world of lung cancer that are making people live longer, and not only live longer, but live well, meaning that they're having their cancer under control without some of those symptoms that you think about with chemotherapy. So when I was talking about surgery for really early lung cancer, that's just one piece of the puzzle for many people. So if you have a lung cancer that we find after it's more than just a tiny group of cells that's the size of a quarter in your lung, say we find it when it's a little bit bigger, say we find it when there's some lymph nodes involved, or if it's even gone farther, there are still great treatments that are available. But because it's already spread, we start to think about other options so that we're attacking the cancer from every angle to give each person the best chance of getting through it and winning the fight against cancer. So there's lots of different treatments depending on the kind of cancer you have, depending on where the cancer is, depending on how healthy each specific person is, how good their lungs are, etc. But that can include radiation therapy. That can include a chemotherapy, which often requires an intravenous infusion or a Metaport that people may think about. And then what's really exciting, and I think what maybe you found in your research, is what's called immunotherapy.
Yeah.
So immunotherapy is, as an oncologist and a cancer doctor myself, it is one of the most, if not the most, exciting advancement of science in the last 15 years, where we're seeing patients come in that have cancer that's spread outside of the lung to other parts of the body, where, you know, even 15 years ago, there would have been really not much that we could offer. That person would have gotten chemotherapy, maybe had some side effects, and do okay.
Yeah.
But now with immunotherapy, we're seeing such great response rates. We're seeing people live twice as long as they used to with the same diagnosis. We're seeing, and like I said, with less side effects, which is so important, because if you're undergoing treatment for cancer, your quality of life is so important, so that you're still, you know, that time that you're, you know, while you're under treatment, you're spending it with your family, you're spending it going to restaurants, you're spending it doing the things you love. So immunotherapy is something that is available to basically anyone who doesn't have the very earliest stage cancers, and that's just because they don't need it. So if it's the very earliest, then we take it out with surgery and you're done. If it's anything more advanced than that, then you'll get a mix of treatments, likely that would include these new exciting treatments.
So how does that work? You know, what are the, like, how does it like, if you can just elaborate on the immunotherapy for us?
Yeah, so traditionally chemotherapy is a medication that goes throughout your body, and it doesn't really target cancer cells. It just scientists have tried to use these chemicals that will kill cancer cells more than it kills other cells. Now, chemotherapy can be life-saving and it can be very great, so I don't want to make it sound like this terrible, scary thing, but there can be some side effects from it. Now, what immunotherapy does is it is harnessing your immune system, so the same immune system that fights off the common cold, that heals if you have a scratch on your arm. We take those same cells and redirect them to the cancer cells itself. So there's less side effects because the medicine isn't going everywhere in the body and attacking all of the cells in the body. It's really just focusing in on the cancer itself and recognizing the cancer as an invader, just like the common cold is an invader in your body, and killing those cells specifically.
Oh, okay. And so are there any clinical trials right now for lung cancer?
So there are a lot of clinical trials. So immunotherapy now that we're at about, again, the 15-year mark, it's now been well studied enough that it's not on clinical trial. It's no longer considered experimental or investigational. It's part of standard care. However, we're still learning about it. You know, this is a fairly new treatment. Things in medicine, we're always very careful to be, making sure that we're doing everything in a safe way.
Okay.
And so as we're understanding more and more about these treatments and other similar treatments for lung cancer, there are a lot of clinical trials that are ongoing.
Okay.
So those would be if you have a diagnosis of lung cancer and you are speaking to your oncologist or your surgeon or your doctor about that. If there's a clinical trial that you might be eligible for, that doctor would give you information about it or give you information about who to talk to about it. But there are a lot of new exciting trials that are ongoing still.
And which patients would be eligible for that, for the clinical trials?
So it depends a lot. So some of what we're still trying to understand in the medical community is who exactly benefits the most from which kind of immunotherapy, because there's a lot of subtleties to it.
Okay.
But there's also some types of lung cancer. That have other characteristics that make them eligible for trials. So it's a hard thing to generalize, but once there's a sample of the tumor and you're seen by a doctor, they would be able to identify whether that's something you might benefit from.
Okay. And so at Houston Methodist, do they have any clinical trials going on for lung cancer?
Yeah.
So I think we're going to take a hold because we are getting on the break.
Oh, okay.
Yes. The conversation's going so well. We need to take a quick break.
Thank you, Layla. So we're going to go on a short break, and when we get back, we will continue our conversation with Dr. Gray. Topic is on lung cancer. If you all have any questions, give us a call. Number is 713-974-4000. Chai Time on 99.5 FM. to Chai Time on 99.5 FM. We are in conversation with Dr. Gray. We have been talking about lung cancer, and as we said earlier, November is Lung Cancer Awareness Month, so this is a good time to talk about it and to educate ourselves and, of course, raise awareness as well. So, Dr. Gray, getting back to our conversation, I asked you about Houston Methodist, like about clinical trials. So they do have clinical trials which are, in Methodist hospitals, right?
Yeah, absolutely. So at Houston Methodist, there's the Neal Cancer Center. So this is a dedicated center within at the medical center that's dedicated for the care of cancer patients. So what's nice about that is it brings together all different kinds of doctors and non-doctors that are involved in treatment of cancer and for patients that have that diagnosis. So that's oncologists that deal with chemo, radiation doctors that might give radiation, surgeons like myself, pulmonologists, meaning those are lung doctors that would treat the lung as a whole. And so within that cancer center, there's a number of trials that are too many to go through here, but that when you are seen as a patient, you might be eligible for, that you would have the option of enrolling in. It is, I also do always like to say that for clinical trials, sometimes I think people can be nervous when they think about clinical trials, because people have this feeling of, I don't want to be experimented on. I don't want, these things to happen maybe without me really understanding what's happening. And so what I would say, no matter where you are, at Houston Methodist, absolutely, but no matter what hospital or doctor you're at, clinical trials are always voluntary, and they're always very, very carefully regulated to make sure that they're safe. So there's ongoing clinical trials that look at the types of medication that are used, the types of immunotherapy, and some of these other things that I was mentioning before. And then also for lung cancer detection, we have a clinical trial that's ongoing right now that uses a swab in the nose, similar to the COVID tests, but that it's just a quick swab when you come in to see the doctor, that try to identify any cancer cells that are throughout the body as a marker of lung cancer. So that's something that we're studying now to see what ways we can pick up lung cancer as early as possible so that you have the best chance of cure.
Okay, and you have been stressing on screening.
Yes.
So, so my next question would be, what happens after screening?
Yeah, so that's a great question. So for what screening for any cancer is, it's taking someone that has no symptoms and doing a test to see if there's something abnormal. Now, abnormal doesn't mean cancer, and I think that's a really important thing to understand also. So for lung cancer, if you are eligible for screening, you would come in, get a CAT scan, and then someone like myself would review that CAT scan and say, hey, there's something that looks a little off here. Now, what happens after that depends on a lot of things. So you would see a doctor, again, someone like myself or an oncologist, who would have a conversation with you about your medical problems, your smoking history, other risk factors that you might have. And then together we make a determination of how likely it is that this thing we found on a screening test, how likely it is that it's cancer. Now, there's lots of different options for what happens then. So say somebody who's very young, who has never smoked, has never been around smoke, what we find on the screening, or that person wouldn't have been screened, but say they had a nodule that was seen on a test done for another reason. So I'm trying to describe a low-risk patient, someone that we're less concerned about having cancer. Maybe we say, we're going to watch this. You as the patient are going to watch for any symptoms that develop, and we're going to get another CAT scan in 3 months or 6 months or a year and make sure that everything still looks okay. Okay? Now, let's say that you are in a screening program, you have a heavy smoking history, you used to or you currently chain smoke, and you're maybe a little bit older, putting you in a higher risk group, and we see something on the CAT scan that we say, we don't want to just watch that. If this is cancer, we want to know. So that would be something that we found on screening. So then there's some other options there. We can do something called a PET scan, which is similar to a CAT scan. It doesn't hurt. You don't go to sleep for it. There's no incisions. It's just a different type of CAT scan that cancer cells light up on that help us understand whether this is something that's more concerning or not. And then the other option is a biopsy. So there's lots of different ways to perform biopsies for lung nodules. So the good news is that a lot of times we can do it without a surgery. A lot of times we can sample or biopsy something that's abnormal, either using a bronchoscope. So that means that we take a small camera, look inside the lungs, and take a sample from the inside. No recovery time for that, no incisions for that. You go home the same day. And the other way that we often do it is with a biopsy from the outside. So that's just a small needle, like similar to the needle that if you're having an IV started or having blood drawn, a needle like that just goes through the side using a CAT scan and takes a little sample of that tissue to determine whether it's cancer or whether it's not. If you do get a diagnosis of cancer, then you would see a cancer specialist to discuss what the treatment options are.
Okay. And you being a specialist in thoracic surgery.
Right, yes.
So we wanted to talk a little bit about that too. So, with surgery.
Yeah. So surgery is a great option because if you have cancer cells, the best way to get rid of cancer cells, and I am a surgeon, so I'm biased, but the best way to get rid of cancer cells is to take them out and put them in the bucket. Throw them away. So a lot of people, I think it can be scary and confusing what lung cancer surgery is.
Yeah.
So there's a lot of things that go into it. A lot of it depends on what other medical problems you have. So if you have lung cancer, you may also have high blood pressure. You may also have heart disease. You may also have some other things that impact your care. I would say most people, the majority of people, are healthy enough to undergo lung cancer surgery. When you met with me and my colleagues, we would make a determination to make sure it was safe for you to have surgery, but most people are able to do that. Most people also, especially people with early stage cancers or cancers that are able to have surgery, live a normal life after cancer surgery. So most people do not go on oxygen after, or if they do require oxygen, it's for a brief period of time while the lung is healing. And most people who undergo lung cancer surgery, they get back to their full level of fitness. And I always tell people, you're not going to miss it. You're not going to miss that part of the lung. Okay? So at Houston Methodist, the way that we do lung cancer surgery is robotically. So this is a really cutting edge technique where we use just really tiny incisions. Lung cancer surgery used to require a pretty sizable incision on the side, and the recovery was harder. There's pain associated with it. People were in the hospital for 5 or 6 or 7 days trying to recover afterwards. But with the robotic surgery, most people have very minimal pain. I always tell people we have more pain medication than you have pain. But most people don't have too much pain after robotic surgery. And most people are in the hospital for something like 2 days. So that's really just been huge in getting people back on their feet, walking again, back to their normal life, back to their normal activities. So if you are someone that may ever need lung surgery, obviously you would see a surgeon, see a specialist, and talk through the process. But I would say that most people, in the majority of cases, tolerate it quite well.
That's amazing. What advancement we've gone through. And we've had one of the doctors from Methodist come and talk about robotic surgery.
Yes.
And that was just, it was like, wow, these things are actually happening. We thought it'll be the future where we are dead and gone.
No, it's very cool. It's very cool stuff. Yeah.
That is. Just seeing it now being done and the benefits of it compared to before is it's just it just puts us at ease. It's not it's not that big a deal in that sense, right? So it's great.
Right.
And earlier we were talking many times when we go to the doctors, we are so overwhelmed, especially if our diagnosis is that we have cancer. So what are the questions that a lung cancer patient should ask their doctor? Because sometimes when we go there, we just don't know what to say or what we should ask. And many times we feel that we don't want to waste the doctor's time, and we have, like Layla said, sometimes we're waiting so many hours, and then when we get in there, we have nothing to say.
Yeah.
Right.
So what would your advice be on that?
Yeah, so my biggest advice is to bring someone with you. So
Okay.
if you're going to any sort of medical appointment that's high stress, especially but not just for cancer, bring a family member, bring a friend. They don't have to have any specialized knowledge. Just having someone there to help receive the information and be there as a support, I think, is so important. As I was saying on the break, when my mom goes to see the doctor, she calls me and I say, "Okay, Mom, what did they say?" And she says, "I don't know." And so you have to go. So I realize, okay, so I need to be there with you, and not just because I'm a doctor, just because you have someone there with you to help observe that information. And then the other thing, there are some specific questions for lung cancer. So you want to know what type it is. You want to know what stage it is and whether it's spread anywhere. One thing that I always tell my patients is, I know you're going to go Google, because everyone, when they find out something new, it is impossible to stay away from Google. So I do not say don't do that. But what I do say is that there are some resources that are really good and really reliable for cancer in general, especially lung cancer. Yes. So the American Cancer Society, I think it's acs.org, but American Cancer Society has some really great resources that in really clear, plain, everyday language talk through some of the treatment options, and they can help you understand maybe what your doctor said at that visit. And then the other resource I would say, it's called the NCCN, also .org. So it's the National Cancer Center Network that also has really great materials that are available for patients. So if you go on there and you say, because if you just Google lung cancer, who knows what you're going to find. But if you go to either acs.org or nccn.org, there's some really great resources available.
Okay, that's good to know.
Yeah.
And also, earlier you wanted to share the phone number for screening as well.
Yes, thank you for reminding me. So, as Lynn said, we have been talking a lot about screening because it is so important. Now, one thing I didn't mention is, how do you do that and where do you go for that? So some primary care doctors will do screening, and if your primary care doctor does it, that's absolutely fine. Houston Methodist actually has a dedicated lung cancer screening center, and that is available both in the Texas Medical Center, but also at a lot of our outlying sites, like in the Woodlands and in Sugarland and some other places. Now, there's a cell phone number for that, or I'm sorry, not a cell phone, a phone number for that, and that number is 713-441-5864, 713-441-5864, and that will connect you to a professional who can help assist you to know whether you qualify for lung cancer screening and also get you in. Now, you can also Google it, as I said. If you Google Houston Methodist lung cancer screening, that'll take you to the website. And I was looking it up right before I came on because I wanted to know what happens when you go to that website. And it actually brings you to a really nice, easy to understand form that you can fill out just some really basic information about your history, and it will tell you whether you qualify or not and connect you to a specialist.
Okay, that's wonderful. And just to let our listeners know, we will put this number on our, on our Facebook page, on our YouTube as well, just so that if anyone wants, to get in touch as well. Dr. Gray, people who seek help with alcohol or drug addiction have resources available, right? So are there any resources available for those seeking to quit smoking?
Yes, and I'm so glad you said that because that's also such an important thing. I think it's so easy to sit here and say, oh, smoking is bad, you should stop smoking. But the reality of stopping smoking is so hard. It becomes a part of your life. It becomes, obviously, as we know, it's addictive, and it's, a medical condition to have that addiction to smoking. And so it's not so easy to quit.
Yeah.
So there's a lot of resources that are available. A lot of primary care, a lot of internists have programs within their practice. So if you're interested, it's worth bringing it up to a healthcare provider that you may already know and trust. And then there's also programs the Houston Methodist Lung Cancer Screening Program also partners with a stop smoking group. So what does that do? So you would be seen by a doctor or a healthcare provider that sees if you would be interested or appropriate for some of the medications that can help stop smoking. So something like Chantix that you might have heard about or something like that can be really incredibly helpful to cutting down the cravings.
Okay.
And then also discussing with professionals and other people who are trying to quit other strategies for other behaviors that you can do, simple things like maybe not going outside on the smoke break when you always go outside on the smoke break, because if you go outside, you're going to be around it, you're going to have those cues, your body's going to want to do that. And so changing some of your habits, and then other things like we talked about earlier with e-cigarettes, which as a lung cancer surgeon and a thoracic surgeon, I cannot endorse those, but I will say that they can be a really nice tool to use to help stop smoking.
Oh, wow.
I know, right?
Yeah.
That's an eye-opener. Well, that's good to know, because I know there are, like some people who do really want to quit smoking, but then, of course, there's so many things that come in the way, life itself, right?
Absolutely.
And all the stress that people go through. So it's so much easier to just go back to it and things like that. So there are options and resources. So that is great to know. Is there anything else that can be done when it comes to prevention for lung cancer beyond not smoking?
Well, one thing that, as we were just having that conversation, I was thinking about how I wanted to mention is stopping smoking whenever you do it, no matter how much you've smoked in the past, will help decrease your risk. So you can reverse some of the damage that's done from smoking by stopping smoking. So if you were a heavy smoker, a chain smoker for 20 years, you may not ever get back to absolute zero cancer risk, but if you don't smoke for 5 or even 10 years, that risk gets lower and lower and lower as your lungs recover and your body recovers. So one thing that I would say, and I know we're harping on this a lot, but it is important, is that it is never too late to quit. And no matter when or what part of your life you're in, you can get benefits from quitting. Other things for prevention are, like we talked about, get a smoke detector that has a radon detector in it, because that is also such a simple thing. They're not expensive. They're $10 at Lowe's or what have you. And then just paying attention to your body. Like I said, that most people that have lung cancer don't have symptoms at first, but eventually will develop symptoms. So if you, have a cough that doesn't go away, if you have, some weight loss that you don't really understand why you're losing weight, maybe you're not really trying to, or your appetite's different, or any of these sort of vague things, just see a doctor and get it checked out. It may be lung cancer, it may be something totally different that also can be treated.
Okay. And if someone is smoking, as a teenager, if someone starts smoking and then later on in their 20s, they kind of quit smoking, an occasional smoker, are they still at higher risk, or would that just be they don't have to really worry about it?
Yeah. So if you have smoked greater than 100 cigarettes in your life, that's sort of the cutoff for when there's a risk associated with it. Now, we know that people that smoke more have more of a risk. So, that person, and I talk to these people a lot in my clinic. They say, no, I only smoked maybe when I was in college back in the 80s or whatever. And I say, that kind of still counts. But it's not nearly as much, because if you think of cigarette smoking as a dose dependent thing, meaning the more you do it, the more risk there is. So that person who maybe smoked back in their 20s and quit, they're not at nearly as much risk as someone who's a current smoker or a heavy smoker. There's a small increase in risk, but like I said, no matter when you quit, it's good.
It's just good to quit.
It's just good to quit. Yes.
I know. So, like the other day I was talking, someone asked me at the restaurant, what topic are you going to talk about this time? And I said, we're going to do lung cancer because it's Lung Cancer Awareness Month. And so this person smokes. And so he said, can you ask the doctor? Because he didn't want to call in. Yeah. He's like, but, I'm an occasional smoker and I don't really smoke a lot. So would that really matter? Or do I just, she knows who I'm talking about. And he goes like, do I need to like then really like, do I have to quit smoking, or is it okay if I just smoke occasionally?
Yeah, it's not okay.
That was easy.
That's an easy question.
So that's exactly what I said to him. But he said, no, you got to ask Dr. Gray.
No, I confirm your suspicions. Yeah.
And I think many times people do say that, right?
Yeah.
They're like, well,
Yeah.
you know, it's just one or two, or,
Yeah.
you know, I don't smoke the whole pack.
Yeah,
so-
well, I mean, and that's better. I always say, you know, if you're going from smoking a pack a day to smoking one a day, that's great. That's progress. That's wonderful. But you still got to get rid of that last one.
Yeah. Which is the hardest.
Yeah, absolutely.
So before we wrap up, Dr. Gray, is there anything else you would like to tell our listeners?
Yeah, you know, I just want to really say that, I think a lot of things in medicine are scary, and I think can be just really hard to understand what's happening, and things just can feel overwhelming. But with lung cancer and with everything else, you know, lung cancer is treatable no matter what stage it is. And I always tell my patients this also, it's better to know what the problem is and take care of the problem than to have no idea that it's going on. Because once we are able to name it and find it, then we can treat it. And no matter what stage, as I was saying before, no matter where it's spread, there's great treatments available. And I think that especially now, doctors, definitely myself and my colleagues at Houston Methodist, but I think everywhere, I think there's much more of a feeling of wanting patients to be comfortable, understand what's happening, and still have that really good quality of life as you're going through treatment, no matter what you're dealing with.
Yeah, that's wonderful. I'm so glad we talked about this.
Yeah.
And, you know, like, even when I'm just thinking, like, even in movies, right, Laila? Like, in Bollywood movies, or, you know, it's always like lung cancer, that means death. Right? So just like talking about it and putting our minds at ease, like everything, there is a cure for it. It's not the end of your life, because sometimes it's our minds like place so many, you know, like there's so many other scenarios. It just keeps on, and mentally
Absolutely.
we get fatigued with it.
Absolutely.
And so this way, like you have and you have simplified it so well today for us.
I'm
It's
glad.
just made it so much easier to understand the importance of it, and of course raising awareness for lung cancer. So we really thank you, and we appreciate you coming here. I know it's been busy. You came from work.
Yes. Yeah, no, it's my pleasure. I'm really happy to be here.
Yeah,
Talk to you guys today.
thank
and
you
we,
so
we
much.
loved it because I was telling her that her personality itself, it's so calming. Her voice, it puts you at ease. So yeah, your patients are really lucky, and you go over the whole information.
Yeah.
So that's awesome. Thank
Maybe
you very
next
much.
time we won't talk about anything on the medical side. More about you.
Yeah, I have some nice tips.
Get to know you.
Yeah, absolutely.
Thank you, Dr. Gray.
All right, yeah, it's my pleasure. Take care.
Thank you. Thank you, listeners, for joining us here on Chai Time. We shall see you same time, same place. Signing off, this is Chai Time on 99.5 FM.